Every morning, millions of people over 60 wake up, walk to the bathroom, and check that little number on their glucometer. And for too many of them, that number is still too high. Despite the medication, despite cutting back on bread and rice and fruit, despite doing everything their doctor told them to do. And here is what nobody is telling those people. There is something sitting in most kitchen cabinets right now, not a prescription, not a supplement, not an expensive powder, that multiple clinical trials have now confirmed can meaningfully lower fasting blood sugar. In one rigorous 2025 analysis of 7 independent studies, patients saw their fasting glucose drop by an average of nearly 22 points. That is not a rounding error. That is a clinically significant number. Today I am going to walk you through exactly what this is, how it works inside your body at the cellular level, the precise way to use it, and who absolutely should not try it. Because this is not one size fits all, and I want you to have the complete picture before you try anything. I'm Dr. Steven, and this channel exists to bring you the latest peer-reviewed research on senior health, translated into clear, practical information you can actually use. If you're not subscribed yet, please do that now, because what we cover here every week is designed specifically for people over 60. And your doctor's 15-minute appointment simply does not have room for all of it. Let's get into it. What the drink actually is. The answer is apple cider vinegar, diluted in water, taken every morning before your first meal. I know. Some of you just rolled your eyes. Stay with me. Because the science behind this is far more compelling than the folk remedy reputation suggests. A 2025 meta-analysis published in Frontiers in Nutrition, one of the most respected peer-reviewed nutrition science journals in the world, analyzed 7 controlled clinical trials involving 463 participants, all diagnosed with type 2 diabetes. The researchers used the grade system, which is the gold standard that medical professionals use to evaluate the reliability of clinical evidence. This was not a blog post. This was a rigorous, methodical analysis of independent studies. The findings: apple cider vinegar significantly reduced fasting blood sugar by an average of nearly 22 milligrams per deciliter. The same analysis found that HbA1c, your 3-month blood sugar average, the number your doctor actually uses to assess how your body manages glucose over time, dropped by an average of 1.5 points. For context, a 1-point drop in HbA1c is often enough to move someone from diabetic range into pre-diabetic range. 1.5 points is genuinely meaningful. That is not a placebo effect. That is biology. Why it works. The mechanism. Your doctor has never explained here is the part that surprises most people. Why would vinegar have any effect on blood sugar? It seems strange. You drink something sour and your blood sugar numbers go down. But the explanation makes complete sense once you understand what is happening inside your body. When you eat carbohydrates, bread, rice, fruit, potatoes, your digestive system breaks them down into simple glucose molecules. That glucose enters your bloodstream and your blood sugar rises. Your pancreas senses this and releases insulin. Insulin acts like a key that fits into locks on the surface of your muscle and fat cells, opening those doors so glucose can move out of the bloodstream and into the cells where it gets burned for energy. The problem in type 2 diabetes and even in prediabetes is that those locks have become stiff. They do not turn as easily as they should. This is called insulin resistance. Your pancreas keeps pumping out more insulin trying to force those doors open, but glucose still cannot get in efficiently. Blood sugar stays elevated. The pancreas works over time. And over years, elevated blood sugar silently damages the small blood vessels feeding your kidneys, your eyes, your nerves, and your heart. Apple cider vinegar appears to address this problem through 3 mechanisms working at the same time. Mechanism 1. The primary active compound in vinegar is acetic acid. Acetic acid slows the activity of specific digestive enzymes called alpha-glucosidases, enzymes responsible for breaking down complex carbohydrates into glucose in your small intestine. When those enzymes slow down, glucose enters your bloodstream more gradually, instead of flooding in all at once. Your pancreas does not have to scramble to produce a massive burst of insulin. The whole system gets a chance to keep up. This is essentially the same mechanism used by a class of prescription diabetes medications called alpha-glucosidase inhibitors, except those are pharmaceutical drugs. Acetic acid is what naturally occurs in vinegar. Mechanism 2. Research published in the European Journal of Clinical Nutrition found that acetic acid also improves how sensitive your muscle cells are to insulin. Those stiff locks on the cell doors become more responsive. Glucose is taken up more efficiently even with the same amount of insulin. This directly addresses the underlying dysfunction in type 2 diabetes, not masking it, but working on the actual root problem. Mechanism 3. Several studies suggest that acetic acid may help suppress overnight glucose production in the liver. Your liver is essentially a glucose factory. It stores glucose and releases it back into your bloodstream overnight to keep your levels from dropping too low during sleep. In people with type 2 diabetes, that factory often overproduces, releasing too much glucose at night and into the early morning even when blood sugar is already adequate. This is called hepatic glucose overproduction, and it is one of the primary reasons fasting blood sugar is elevated in so many patients. Acetic acid appears to dampen that overproduction, signaling the liver to hold back. The result is a lower morning number before you have eaten a single bite. That is why it particularly helps that fasting reading, the number you see first thing in the morning that keeps frustrating you. The dawn phenomenon, why your morning number is often the worst. Comment below right now and tell me, what is your typical morning fasting blood sugar reading? Just drop the number. I want to see what this community is actually experiencing. Here's something that surprises many people. A lot of seniors find that their fasting blood sugar in the morning is actually higher than their reading 2 hours after dinner. That seems backwards. You have not eaten all night. Should your blood sugar not be at its lowest? Not necessarily. Not if you are experiencing what is called the dawn phenomenon. In the early morning hours, roughly between 3 and 8 in the morning, your body releases a wave of hormones, cortisol, growth hormone, adrenaline, designed to prepare you to wake up and become active. These hormones signal your liver to release stored glucose into the bloodstream to give you energy for the day ahead. In a healthy person with normal insulin sensitivity, that glucose release is handled quickly and blood sugar stays in a normal range. But when insulin resistance is present, your body cannot efficiently manage that liver release and you wake up with an elevated reading that has nothing to do with what you had for dinner. The dawn phenomenon becomes more pronounced as we age and our insulin response slows further. It affects a significant number of people with type 2 diabetes and prediabetes, and it is one of the reasons why the timing of this drink matters so much. The studies showing the strongest results used vinegar either the evening before or first thing in the morning on an empty stomach. The pre-meal morning timing appears to blunt that early liver glucose release and prime your muscle cells to handle the carbohydrates from your first meal more efficiently. You get a double benefit, better fasting numbers and better post-meal numbers throughout the day. A real patient story. Margaret came to me at 71 years old, frustrated and genuinely defeated. Her fasting blood sugar had been hovering between 145 and 165 milligrams per deciliter for 2 consecutive years. She was already on metformin. She had dramatically reduced her carbohydrate intake. Her doctor had recently started mentioning the possibility of adding a second medication. She wanted to try something evidence-based before going down that road. We reviewed the research together. We talked through the potential risks and how to monitor safely. And she committed to a consistent morning routine for 12 weeks, alongside a 15-minute walk after dinner, which is independently supported by research as a blood sugar management tool, and a modest reduction in evening starch portions. At her next blood draw, her fasting blood sugar had dropped to an average of 118. Her HbA1c came down from 7.9 to 6.8. Her physician was satisfied enough to defer the second medication entirely. Margaret still does the morning drink every single day. She says it takes 30 seconds and costs less than $1 a week. What the research also found about cholesterol. Here is something that genuinely surprised me when I went back through the complete body of evidence. A 2023 randomized controlled trial, the strongest type of clinical study, published in Frontiers in Clinical Diabetes and Healthcare, followed 80 patients with type 2 diabetes for 8 weeks. The group taking apple cider vinegar daily saw the expected drops in fasting blood glucose and HbA1c. But the researchers also found something they had not primarily set out to measure: LDL cholesterol, the type most associated with arterial plaque and heart attack risk, dropped significantly in the vinegar group compared to the control group. Total cholesterol and the ratio of bad to good cholesterol also improved meaningfully. The control group, following the same dietary recommendations without the vinegar, did not see those lipid improvements. This matters enormously for people over 60. Type 2 diabetes and cardiovascular disease are tightly linked. High blood sugar damages the inner lining of artery walls, making them more vulnerable to cholesterol deposits. Inflammation rises throughout the vascular system. The cumulative risk of heart attack and stroke climbs steadily. Finding a single daily habit that appears to address both blood sugar control and cholesterol levels simultaneously is genuinely significant. Who should not use this? I want to be equally direct about who this approach is not appropriate for, because this matters just as much as everything I have told you so far. If you have been diagnosed with gastroparesis, delayed stomach emptying, which can develop after years of poorly controlled diabetes, acetic acid can worsen that condition by further slowing digestion. Do not use this approach without first discussing it with your gastroenterologist. If you have chronic kidney disease at stage 3 or higher, your kidneys may struggle to process the acid load over time. If you have a history of acid reflux disease, a hiatal hernia, or stomach ulcers, even diluted vinegar can aggravate those conditions. Always discuss with your doctor first. There are also important medication interactions. Apple cider vinegar can interact with diuretics, water pills commonly used for blood pressure and heart failure, because both affect potassium levels. Potassium is critical for heart rhythm, and too little is dangerous. Most critically, if you are on insulin, the blood sugar lowering effect of apple cider vinegar may compound the effect of your insulin dose and cause hypoglycemia. Low blood sugar in people over 60 can be dangerous and even life-threatening. This absolutely requires medical supervision before you begin. The exact protocol. Here is precisely what to do based on the clinical evidence. Step 1. Choose the right product. You want raw, unfiltered apple cider vinegar that still contains what is called the mother, the cloudy, stringy sediment at the bottom of the bottle that contains beneficial enzymes, proteins, and naturally occurring bacteria. The most widely available brand meeting these criteria is Bragg Organic Apple Cider Vinegar with the mother. You can find it at Walmart, Target, Kroger, Whole Foods, CVS, or on Amazon for typically between $5 and $8. On the label, look for the words raw, unfiltered, and with the mother. A perfectly clear vinegar with no cloudiness has been filtered and lacks those beneficial components. Step 2. Dilute it correctly every single time. Never drink apple cider vinegar straight. Undiluted vinegar is highly acidic. Drinking it straight can erode your tooth enamel over time, irritate or burn your esophagus, and damage your stomach lining. The dose used in the studies was 1 to 2 tablespoons, that is 15 to 30 milliliters, diluted in a full 8-ounce glass of water. Start with 1 tablespoon. 1 tablespoon in 8 ounces of water is your starting point for the first 4 weeks. If you tolerate it well with no throat irritation or stomach discomfort, you may consider increasing to 2 tablespoons at week 5. If you ever feel burning anywhere, reduce the amount immediately. Step 3. Take it at the right time and in the right way. Drink it first thing in the morning on an empty stomach, approximately 15 to 30 minutes before breakfast. Use a straw if possible to minimize contact with your teeth. After you finish, rinse your mouth with plain water. Do not brush your teeth for at least 30 minutes afterward. The temporary softening of tooth enamel from the acid means brushing immediately can cause microabrasion. This is a small but important detail that most guides leave out completely. Step 4. Track your numbers. If you have a home glucometer, check your fasting blood sugar each morning before drinking and before eating. Write the number down with the date. Do this consistently for 8 to 12 weeks. You are looking for a downward trend. Not a dramatic drop in week 1, but a gradual improvement across weeks 4 through 12. The first 2 weeks are your body adjusting. Weeks 3 through 6 are where people typically begin seeing the beginning of a trend. Weeks 7 through 12 are where that trend becomes clear enough to be meaningful. Bring that log to your next doctor's appointment. That data gives your physician something concrete to evaluate and turns the conversation from vague to specific. Step 5. Realistic expectations and timeline. The clinical trials showed meaningful improvements in fasting blood sugar within 4 to 8 weeks of consistent daily use. HbA1c changes take longer because that number reflects 3 full months of blood sugar patterns. Give this a minimum of 12 weeks before assessing its impact on your HbA1c at a lab draw. Consistency is everything. Taking it 3 days, skipping a week, resuming for 2 days, that will not produce the results the studies showed. The results come from daily, disciplined use over weeks. A final word on the evidence. I want to be completely honest with you about the limitations, because you deserve accuracy, not just enthusiasm. The 7 studies in the major meta-analysis ranged from 4 to 12 weeks in duration. Most were conducted outside the United States. The total number of participants across all studies was 463. Meaningful, but not the same as a large multi-center American trial followed for years. The evidence quality was rated as low to moderate for some outcomes when evaluated with grade criteria, meaning we cannot make absolute guarantees. Apple cider vinegar is a supportive tool with real biological mechanisms and real clinical data behind it. It is not a cure. It should not be used as a reason to stop or reduce medication without your doctor's direct guidance. What it is, for the right person, used consistently and safely, is one of the most evidence-backed, lowest cost, most accessible tools available for morning blood sugar management. Now I want to hear from you. Drop the word trying in the comments if you are going to commit to this for 8 full weeks. Share your current morning fasting number if you are comfortable. This community is a safe place, and your number might help someone else feel less alone in their struggle. Or comment sharing if there is someone you care about who is fighting this same battle every morning. Every comment helps this information reach more people who genuinely need it. Please subscribe and hit the notification bell, because next week I am covering something that surprises nearly every patient I work with. A specific breakfast food most seniors believe is one of the healthiest choices for blood sugar. But that recent research shows consistently raises fasting glucose in people over 60. It is probably in your refrigerator right now. I'm Dr. Steven. Take good care of yourself. You deserve to understand exactly what is happening inside your own body.